Alright guys, so today we're doing something different. We have a lady with chronic Dercum's disease, and she has a lot of pain on her rib cage. And what we're going to try to do later on is to do aggressive liposuction of the areas with the special cannulas, try to remove as many painful lipomas as we can. And then after that, we're going to make a larger incision and take residual lipomas out. I anticipate we're going to have probably 50, 60, 70 lipomas. And you will see the video how we do it. We'll see how it goes. Hi guys, Dr. Volshteyn. We have one of the challenging cases. This lady has been having pain in the chest, right on top of her ribs and abdomen for the last 15 years. She was biopsied, showed lipomas. Eventually she was diagnosed with Dercum's disease. And when you feel it, it feels like she has like a bunch of tiny lipomas underneath. So she eventually ended up here. And we're trying the area on the right abdomen. You can see this is a rib cage right here, and this is the abdomen. So this is the area we're working on. I just did pretty aggressive liposuction. If you could swing over, show the bottom. Yep, great. And remove a bit of that fat. You can feel it clumpy, but once we remove that major fat, you can feel, I can run my fingers like this under the skin, and I can feel all those little lipomas embedded inside. Can't even take it with liposuction. And this is what they look like, a bunch of little tumors. They're benign, they look like lipomas, they're just a little bit more dense. Not as rubbery as I would expect, but pretty dense. And they're located all throughout the skin, on top of the muscle, inside of the upper layer of the muscle, under the superficial fascia, and under the skin, and they're spread all over. So what I just did, and I had actually 3 patients like this, so what I do, I empty out the area from the normal fat using liposuction, and they go in and actually take out a bunch of lipomas manually using what you see, the slided retractor. And we took a bunch of them already. I just wanted to show you what it looks like. One of the most frustrating diseases, because most people don't understand it, most doctors don't know what to do with it. So I have probably a dozen more here that I have to remove. And unfortunately, we don't know 100% how much it's going to help. Usually, if we get about 70% reduction of the pain, I think it's usually worthwhile doing that surgery. So I just wanted to film this for you so you see that there are options for this micronodular Dercum's disease. I wanted to give you an update on our patient with Dercum's disease that you probably see me doing on the previous video in the operating room. And if you recall, the lady has really like thousands of very painful lipomas. They're very tiny, they're about this big in size. And they're located throughout her chest wall, arms, and legs. And she can barely lay on the side, and she cannot do a lot of other things. She has some unusual symptoms where they really don't make sense from the medical standpoint, where she would feel the pain and swelling and difficulty breathing after she eats or after movement, bowel movement, which really doesn't make sense from a medical standpoint, but believe it or not, more common in patients with with Dercum's disease. And lipedema, as you would think. So I was curious because we did a test area. I did this large of the test area on her right abdominal wall, and we took hundreds of lipomas after doing liposuction, and we also took a special endoscopic retractor to make sure that we removed as much as I could. So today was the first post-operative visit. She's 1 week out. And I was kind of curious on how she's doing. And actually, she's doing great. She reports very significant improvement. Even immediately after the surgery, while she was swollen, she felt that the pain was remarkably better. She could move, she could breathe. Usually, she would get like a pain and swelling after having the meals. She does not have it in that area. She can even lay on the side. So this is really promising from the standpoint of what needs to be done. But here's the problem. She does have Medicare, and Medicare does not recognize liposuction as a valid medical treatment. And going in and excising each one of those individual tiny lipomas doesn't really work. It creates tremendous amount of scarring. It's almost like you got shot with a shotgun with all these little openings. So we have a problem because we cannot authorize it with Medicare. We cannot pre-authorize it. They do not recognize the procedure codes for liposuction as medically necessary. It's considered to be reconstructive, cosmetic. So we are at a pickle right now. She is going to try to see what she can do in order to get it covered. But unfortunately, again, Medicare does not provide pre-authorization. And that's a problem with a lot of patients with Dercum's disease, where it's so rare, it's so underdiagnosed that there is no really treatment modality specifically designed for these patients. But I'm very optimistic. This is the third patient with the same condition that we treated with the same technique, and all of them have very nice results. Now it's a matter of getting coverage to get the arms, the legs, and the rest of the abdomen covered. So